We all recognize there's a need for treatment high-risk non-muscle-invasive bladder cancer. The current standard is to give BCG treatments, and the good news is about 2/3 of patients will have a good response to BCG. The problem is that if you don't have a good response to BCG, we don't have great alternatives. The only approved drug right now is valrubicin, and has about a 10 to 15% response at a year. And unfortunately, some patients will progress on treatment. And so there is a need for patients to have treatments with BCG unresponsive disease, because the alternative is to take out their bladder. And we all know that that lowers your quality of life and has significant risk of complications. Because of the fact that checkpoint inhibitors have shown response to metastatic disease, there's been a large interest to see if it can be beneficial in patients with non-invasive disease. And so this trial looked at pembrolizumab in patients with BCG unresponsive disease and found that at 3 months, about 40% of patients had a good response. Now, they presented some of the interim data that showed that a significant number of these patients had a durable response up to 6 to 9 months. This was an incomplete reporting of the trial. It was about 100 patients out of 140 or 150 that will be enrolled. And so it'll be interesting to see whether or not there's a long-term response and what the overall complete response rate will be. Obviously, if it maintains a rate of 40% or even a little bit less than that at 1 year, there's a good chance the FDA will approve this as a treatment for patients with non-invasive BCG unresponsive disease.